We initially presented the first component of our research at the Survivorship Symposium in January in San Francisco. That one was primarily looking at breast cancer survivors and essentially how weight affects breast cancer patients. There's a lot of data that's shown to date that essentially weight and obesity in particular will affect survival in premenopausal and postmenopausal women in breast cancer. And looking at the biological aspects of it, there's definitely a lot of mechanisms that we can see that would influence survival with increasing weight and particularly obesity. So our goal was essentially to look at what kind of weight control strategies are out there and is there any recommendations we can make. I think a lot of patients ask us, what can I do to make sure my cancer never comes back? What can I do to increase my chances as much as possible? And it's hard because there's no data to support anything really in terms of what the patients can do themselves, and a lot of them will take supplements or change their diets or do a lot of things that have no evidence to guide it. So we thought that we would try to answer that question and look at what data has been published and what we can gather. Looking at whether or not diet alone or exercise alone or combination regimens are superior, and that was essentially the initial analyses of our study, is to look at that. And we're currently looking at other analyses to have a little bit more geometry in terms of the specifics, so comparing directly different exercise interventions, different dietary interventions. And what another component that's very difficult is that a lot of these are trials, and as you know, in trials we essentially look at Olympians, the best patients we could possibly enroll in these trials, and looking at designs that are very, very well controlled. When you have someone watching your every move, then you may be a little bit more compliant, but in the real life setting, how can patients get through with some of these interventions and exercise and diets, and is it really feasible for them to get through it? And that was part of our analyses as well.